Hi guys, my name is Kishma Jenkins and I'm going to discuss my article, and it's called The Identification of Pica Behaviors in Youth with Sickle Cell Disease. And so before I actually get into discussing my whole article, I'm going to go over some of the main vocabulary words that you will probably hear throughout the whole thing. And so pica is the persistent mouthing or eating of non-edible substances, and it usually begins with the person eating ice and chewing on ice all the time, and then it persists into the person eating worse objects that are non-edible, and they can actually mess your body up. And anemia, it is the decrease in the total amount of red blood cells in the blood and lowered ability of the blood to carry oxygen. Sickle cell anemia is a severe hereditary form of anemia in which a mutated form of hemoglobin distorts the red blood cells into a crescent shape at low oxygen levels. And PDSA is an acronym, and it stands for Plan to Do Study Act. And QI is a quality improvement initiative. And so the experiment, it was mainly, the goal of the experiment was for the screening of the patients that had sickle cell anemia. It was for them to actually have an actual screening of pica, because they were sent to psychologists, but they were never actually screened for the actual disease. And so the initial PDSA cycle, it was for the trial of incorporation of pica screening for all patients newly referred for a psychology consultation. And the second cycle, it was an analysis of data collection across the first 5 months of the QI initiative, and it revealed the consumption of non-food items had been identified in only one patient not diagnosed with sickle cell disease. The third PDSA cycle was developed to focus assessment on those patients most at risk. By month 8 of the 12-month QI project, psychology providers were consistently documenting assessment for pica behaviors in 100% of new consults for sickle cell disease. The QI project was continued for the 12 plan month to ensure sustainability. And so the results of this whole experiment, it showed that 95% of the group that was tested the first time, it showed that they were receiving actual treatment, and the treatment that they were receiving, it was actually working. And so the last 12 months of the whole 18-month trial, it showed that great improvement. Most of the people that were within the whole trial thing, they actually almost met the goal, and the goal was 95%. And most of the people, they didn't make it quite there, but they made it pretty close to the actual goal line. And so during the project period, 49 patients endorsed either history of or current consumption of non-food items, resulting in an overall identification rate of 28%. So 28% of those 49 people that were they had a history of it, but it wasn't actually diagnosed, they actually had pica. And so with this article, there are a few things that weren't the best with it. A lot of the main details were left out. They never did indicate the total amount of patients that were. They just indicated the number that was that they identified. They never did actually indicate the total amount of youth that were did it. And then they also never did say what the age range was of who they tested. They didn't say whether it was from toddler age to adolescents, or whether it was just mainly teenagers. They never said that. So therefore the results could have been different. We never know some of the main things, whether the results were just effective in teenagers or toddlers or middle age. We don't know the age range, and how those results could have changed. And so, but the whole idea of this experiment, it was good, because many types of treatments were done previously before the QI project. And this one, it really did work because of the questions that they asked. They asked the patients whether they had a history, and within that one question, they were able to go off many other things that the patients had. So therefore, like, this overall, like, article, it was great. It did show, like, great treatment. The treatment worked. So therefore, like, it was great. It was just the article, it just didn't reveal as much detail as it could have. So thanks, guys. Thanks for watching my video. It was great talking to you guys. So bye.